April was Head and Neck Cancer Awareness Month, and Penn State Health just wrapped up a powerful campaign called Let's Get Ahead, Curing Head and Neck Cancer Together. The goal, raise awareness, expand access to early screenings, and fund life-saving research. Today, we're checking in on the results with Dr. Neerav Goyal. He is the chief of the Division of Head and Neck Oncology and Surgery at Penn State Health. Let's start with the big news. How much did the Let's Get Ahead campaign raise this year, and then how are you going to use those funds?
It really has been amazing, the support that we've gotten from the community and from our families and friends. We raised over $52,000. So again, congratulations to everyone for their support. And we really hope to use this money, exactly like you said, to raise and increase community awareness, to do more community outreach and really improve the screening that we're able to offer our patients and continue our path forward in groundbreaking research.
For sure. And you mentioned the importance of awareness, so let's talk more about that. Why is that so critical, especially for head and neck cancers, and what cancers fall into this category?
It is a pretty big category. So I'd essentially say all cancers that are above the collarbone and outside of the brain. So we think about skin cancers, which you may not commonly think of as head and neck cancers, but skin cancers of the face, of the ears, of the neck, and also thinking about cancers inside the throat, the tongue, the mouth. The reason that awareness is important is because outside of skin cancer, a lot of times there isn't something obvious to see. And the symptoms can seem pretty benign, but they just don't go away. So symptoms like a sore throat, even a stuffy nose, frequent nosebleeds. But the importance is that they don't get better. They last for weeks or months and they continue to get worse, and that's really the signs that something more could be going on.
So the awareness is one part of it. Detection, of course, a big part of it, because that can save lives. So
Sure.
How are the funds expanding access to, screenings and things like that?
Right, yeah, so we continue to do annual screenings for head and neck cancer, and we're going to be using this money to really help support and improve those screenings and maybe even do them more than once a year to really expand that community outreach. The other piece is patient education. So, we've been at the Bears games, we go to a lot of different community events to really advertise and support vaccination, because there actually are vaccines that can reduce the risk of head and neck cancer.
This is kind of a common theme today, but talking about Penn State Health really being at the forefront
Yes.
of almost everything you do, I think. Talk about some of the latest advancements in head and neck cancers, and it's happening right here.
Yeah, so I think that's a great question. So a couple things. One, we are the only hospital in the region that has access to the newest robotic technology. So that's the Da Vinci SP. And really that allows us to provide surgeries through smaller openings with faster healing, less bleeding, quicker recovery, and getting rid of the cancer. The other piece of that is clinical trials. So we are just opening a new clinical trial that's going to allow access to new medications that can cure skin cancers without potentially needing aggressive face-changing surgeries.
Wow, and that the constant research is what makes all of these new technologies possible, right? And for somebody watching, let's talk about risks, symptoms, because you said, just like a sore throat. If I get a sore throat, I'm not going to think, oh my gosh, I have
Yes.
cancer.
Yeah.
So what kind of things should they look for?
Sure, and if you think about risk, we really think about smoking and drinking. Those are some of the biggest risks as it relates to the traditional head and neck cancers inside the throat. Sun exposure, so wearing sunscreen, definitely a big way to protect against skin cancer. What are the things we should look for? It's really the fact that those symptoms don't go away or they continue to worsen. So, you've been around someone who's sick, you get a sore throat, very easy to say that that's a cold. 3 months later, you're still feeling that significant sore throat, it's getting worse, it's affecting your ability to eat. That definitely requires more attention and evaluation.
Do you think sometimes patients, though, they don't want to, you're like, wow, how do I say this? The sore throat's been around for a while.
Right.
It's probably nothing. It's
Right.
probably nothing. What would you say to encourage folks? You should check in.
Well, really the issue is that we don't want it to be caught when it's much more advanced. And so that is the reason I'd say it is worth getting checked in. Doesn't mean you need to get into a specialist's office, but really checking with your family doctor and saying, hey, this has been lingering for much more than the winter season. I've had nosebleeds that I never had before, and now it's been going on 3-4 months. Those are reasons to be checked out. In my mind, usually if a symptom lasts more than a month, that's reason for further evaluation.
And we started the segment off talking about this campaign that you launched that did really, really well this year. How does public support for campaigns like this really advance what you're doing and drive that long-term impact on positive patient outcomes?
It really does, because it allows us to approach things that need money to really engage and really support research. So we think about looking at new technologies on managing lymphedema, so swelling that people get in their arms or their legs after treatment. new technologies that are looking at genetic alterations that cause thyroid cancer. So things that can then be used to change the way that we practice medicine, change the way that we treat patients, and potentially improve our ability to treat cancer earlier.
Wow, and all the treatments that folks are receiving right now stemmed from probably past research, right? And being part of those studies. So it's just super interesting. You're always like kind of paying it forward and helping somebody else. Thank you for being here, Dr. Goyal.
Thank you so much for having me.
Really nice to see you. For more information, or if you would like to make an appointment with Penn State Health, oh gosh, you say the word.
Otolaryngology.
Thank you.
Yes.
Call 717-531-6822.